Welcome everyone. This is our weekly live session for Q&A. Any health and fitness questions you have, feel free to throw them in the chat. I will answer them as I see them come up. If you're watching on the replay, feel free. You can still throw your questions in. We'll just cover them in the following week's live session as we see them come up from there, even if it's an older post. And for anyone who prefers, we are putting all of our old sessions of these on our YouTube channel since Facebook's no longer storing live videos indefinitely. So you can give us a subscribe and follow there, and we'll throw in some different content from time to time. That way it's not just the same thing that you see here. I will note that I do clean up the videos a little bit to minimize the dead air time that sometimes the live sessions get. So we're opening up a question you get sometimes, usually in passing, sometimes networking, but it's a common question still, and that's when should I hire a trainer? And there's a couple different kind of levels, situations, if you will, that are the most common for this. The first one, kind of the most obvious one, if you've never worked out before. If you're starting out, you've never worked out before, you don't really have anyone that has the experience to kind of help you out and show you, that's a good time to get help. Because if you don't really know what you're doing, the potential for hurting yourself, it's there. It's not necessarily extremely high depending on what type of programming or exercises you do. Obviously, there's very safe machines and things that you can do in a gym setting where the likelihood of hurting yourself is going to be relatively low. But it may not even be an aspect of a what we would call like an acute or catastrophic injury, but just the sense that if you're just kind of going in, training on vibes based upon like what machines feel comfortable or what feels good, you may not have machines quite set up right for optimal movement, or you may be imbalancedly training your muscles to where everything feels good when you push. Pull, maybe it's more difficult, so you avoid those. So you're creating imbalance around your shoulders, or you're creating imbalance somewhere in your legs. Having a trainer develop a program for you can help alleviate those potential issues and make sure that your program is balanced, that we're not overtraining and undertraining certain areas and creating things that can cause issues further down the line. So that's one of the things that a lot of people don't necessarily think about when it comes to training programs. Training problems and injuries related to poor programming doesn't necessarily mean that we're getting an acute severe injury right in the moment. It can be things that because we have created a structural imbalance that something will cause a problem, whether it's an overuse issue because now we're creating imbalanced forces through a joint over and over time, or we just create a problem that will be exacerbated later once it's more extreme, and then we see something more acute develop. So not something that you want to have happen, either acute or that prolonged, just slow build up into a constant ache. Neither of those are fun things. Having a trainer that has the experience to show you what to do, balance your program so we're not creating any inappropriate training factors is a great way to get started. And ideally, you can learn the ropes and learn enough that you can then, if you are motivated, disciplined, you can continue on your own. For a lot of people, indefinitely, and that's the beauty of getting it right from the start. Is you've learned the proper technique, you've learned the proper form, you know enough after a few if you train anywhere between 3 to 9 months with a trainer, you should know enough variation of what a workout should look like that you can do things on your own and never run into some of the issues that we mentioned before as far as imbalances, ignoring different muscles, and things of that nature. Is really after that, it's just a matter of your commitment and discipline to keep the habit going long term. Um, so that's obviously a common one. Another one, similar but different. A lot of times we get people who have worked out previously, but a good amount of time has passed since that last time that they were consistent with it, and because either we've put on either a lot of weight or maybe an injury or health condition has come up to where now kind of unsure or doing what we used to do is uncomfortable, or a thing that I hear a lot, especially with former athletes, especially in the case where it's been 20 plus years since they've worked out, they decide that, okay, I need to do something about this. They go to the programs that they know from their younger days, and every time they initiate a workout plan, something gets hurt. Every time. So they'll get started, something starts to hurt, they take time off, get started, and they'll repeat that process a few times until they finally give up completely or they start looking for help. One of the things to kind of keep in mind is just because you've worked out in the past, yes, you may have a decent understanding of form, technique, and maybe even how to put a program together, an aspect of not creating muscle imbalances. The challenge is most of your knowledge is based upon the you of your youth, when you can bounce back from tough workouts, intense things, aches, pains, and stressors you didn't notice as much. Whereas now, if we've got more body weight kind of weighing down on us, or we've got some injuries that have accrued, or a health condition, trying to go to those older, more intense programs, not usually the best thing to do at that point. We have to readjust, do more of an introductory based type training program, get your body reacquainted with moving, especially with how it is now, because typically, regardless of what you're doing for work, in 20 years, if you haven't been doing some sort of workout plan to keep it in balance, you've probably developed some sort of muscle imbalances, either from what we call repetitive use syndromes, where if you're doing something where it's over and over and over again the same thing, we've got to take that into consideration with your training and make certain things more focused and other things less focused, because we're trying to undo some of the tightness and over tension. Other people, desk work especially, things get pulled out of alignment just because we end up stuck in certain positions all day. That has to be taken into account into your program. More stretching for certain muscles, strengthening for others, and that way we alleviate the potential for an injury to occur during your training program and outside when you're doing other stuff now that you're feeling better. So that's a common time where we see people looking for help, is where, hey, I used to work out, but what used to work isn't working for me because I can't do it without getting hurt because it's been too long since I've worked out regularly. Common time, nothing wrong with that. We can definitely help people in that situation. Another time for people looking for personal training is post physical therapy. And this can be either you did physical therapy because of an injury, maybe some sort of major surgery, whatever the case, you did your thing with medical, you got your thing for physical therapy, they've given you clearance to return to normal activity, and usually they'll give you a handout with some different exercises. Some are what things that you've been doing, some are like this is kind of the one next step after that, but there's not a whole lot of guidance beyond that. And people kind of find themselves in a bind where it's just like, well, I don't know what else to do. I've been doing the therapy exercises for 6 months they gave me now, but like I'm not challenged anymore, and I want to make sure that I don't get hurt anymore. I want to make sure that I keep the strength going in the direction that I've gotten it kickstarted with from the physical therapy, but they're not sure where to take that next step to. That's where personal training can come in and kind of help build on what you've achieved already. Another common factor for people post physical therapy, especially in the case of if it was therapy for a very specific injury or operation joint, Most of your exercises are really only going to pertain to whatever joint you were there for, and you don't have anything for the rest of the body and aspects of maintaining and building a workout program. And a lot of people kind of feel stuck where they're like, well, like, I know I need to do something to keep this from not getting hurt again, but I don't know what to do for the rest of the body. And that's where personal training can come in. But we can take into consideration what you were working on with physical therapy and then expand that into a full body focus for your workouts during the week. Usually 2 or 3 days a week, we can build on whatever your base foundation of physical therapy was for whatever joint we were concerned with and give you a more full program. So now we can see better progress from a whole body aspect rather than just only that joint and that joint itself. And then last reason, this is a common thing, but kind of 2 branches to it. Someone who's trying and been working out consistently, but I shouldn't say consistent, someone who's been working out. There's 2 kind of branches from there. Some they've been working out, but they've had no success, either because for whatever reason they're not overly consistent with it, kind of they'll start and stop, or motivation just never really gets them going the whole way, or the environment or area that they're trying to work out in, they're just never really feel 100% comfortable there. So there's that constant friction of going on top of all the aspects of needing the motivation, needing the drive, the commitment. Now we've got that emotional resistance of going. So finding a place that you're comfortable going to, the right environment, the right type of program training is important. Not everyone is cut out for a group setting. Not everyone enjoys the big, crowded commercial gym. Not everyone enjoys one-on-one private attention and focus. So it's finding what environment, what method you really vibe enough with to feel motivated and drawn to rather than resistant in going to. That's a real common issue that we see a lot. We only do private personal training at our facility, so we get a lot of people who have been, they're just uncomfortable in a group class. They're uncomfortable in the big crowded public gym setting, whether they know what they're doing or not. They just don't like being in the crowds that a lot of those facilities have. So they're looking for somewhere more quiet, calm, and private, and that's one area that we focus on offering for the public in order to meet that need, because it's not a common site for most places, because most places usually are working on a volume focus. Not any one program works for everyone, so it's finding what's comfortable for you. Some people really like the group; they like having that big community. They like having a whole bunch of people to check in with and talk to when they go in. Others like that's uncomfortable. They don't want to be around that many people. They're afraid of being the center of attention. They want to come in quiet, private, get in and get out. Either one's fine as long as you're comfortable and you can get consistent with it. The other factor of someone who's been working out, they've seen great success from the start. Maybe it's been 3 months, maybe it's been 6 months, maybe it's been a couple years, but you've hit a point where now what you've been doing, you've still got more that you want to accomplish and you just can't quite get to that next level. Or the other factor is everything's been working and then now all of a sudden it doesn't seem to be working at all anymore. That's more common for people as you're hitting kind of that 40, somewhere between 40 to 50 age group is kind of where that starts to happen. Both men and women, but women tend to ask for help more than men do. So guys, suck it up. If you're frustrated with your progress, come ask. We're private. You don't have to worry about it. No one's going to judge you. Get your help. Take care of your body. Get in condition. The body changes every 5 to 10 years. physiologically. So a lot of the things that you were doing end up not working anymore, and all of a sudden battling your weight, keeping the physique that you've been able to sustain for a long period of time is all of a sudden a hard and it feels like a losing battle. That is a key big time to come in and look for a personal trainer that we can help you and identify what needs to shift. Because the challenge is if what's working isn't what worked isn't working anymore, we need to look at and see what do we need to change. Are there some different nutritional tweaks we can make, or is it components of your workouts that we need to adjust? They can be worked through. We can still start seeing more success and more results again. It's just a matter of knowing what the next steps are. And if you've only ever kind of been going by yourself in your own body, the knowledge limitation sometimes hits a point where you don't know what else can be changed to keep seeing results. And that's where a personal trainer comes in, so we can help you out in that regard, making sure that you get to the next level, or just simply making it so you don't feel like you're in a losing battle with your body as you enter into that next phase of aging. It is a common challenge. You don't have to feel stuck. There are ways to train through it, train around it. Sometimes it's just changing a few different variables and methods of your training, and then a few little tweaks of your nutrition. Especially if you've been consistent, it's much easier at that point because there's smaller things to be adjusted rather than a full lifestyle change for someone who's just starting out and now needs to clean everything up and then some. So just a few things to kind of think about. Like I said, all of those were aspects of when is a good time to get started with a personal trainer. If you think that you're kind of in one of those boats, feel free, reach out to us. We're more than happy to help. We have, you can message us directly. We can set up a call. You can come in, whatever you're comfortable with, so we can talk and see what the next best steps are for you. Otherwise, keep going, keep consistent. The bigger focus is identifying what positive, healthy changes you can make and keep building on that success. Hope everyone has a great week, and remember to stay persistent in your consistent pursuit of health.